one of my last semesters of college in the burn progressive unit at a hospital in Grand Rapids, Michigan. And whenever I was there, I cared for a woman who came in with really severe burn injuries, and she had to be intubated. During this process, I met her family, and they didn't really know how to speak English. So we were able to uncover that she was actually an undocumented immigrant. Her story was an amazing one, and it really made me a lot more passionate for this population of people. So as a BSN, a Bachelor of Science in Nursing, this is a really important subject for me because a lot of the people that I see are undocumented immigrants, especially in Grand Rapids, Michigan. But the purpose of this speech is to give a voice to this voiceless population of women, the undocumented Hispanic women. So as women are image bearers of God and deeply loved by the Father, we should also love these women too. So we have to be able to understand their needs and the issues that they face in order to be able to truly care for these people. Undocumented Hispanic women really struggle because they have a lack of education. So according to an article by the Review of Higher Education, undocumented immigrants have a really hard time receiving education. But the Fact Talk website discussed that Hispanics hold education very highly. So this is really difficult because Hispanic women really care about their education but don't have access to it. Another reason that they struggle is because women who are undocumented immigrants have a lack of health care, including prenatal care. So in an article I read by the Center for American Progress discusses that immigrant Hispanic women have little to no access to health care. So this includes prenatal care, this includes any doctor's visits, pap smears, anything like that. Women don't have access to it if they're an undocumented immigrant. In a study titled Undocumented Pregnant Women, What Does the Literature Tell Us? It shows that undocumented Hispanic women are more likely to have low birth weight babies, complications in pregnancy, and lack of prenatal care due to health insurance problems. They also fear deportation as well whenever they go to the hospitals. The undocumented Hispanic woman also may suffer greatly because they may have a lot of mental health hardships because of their extreme poverty and extreme issues that they face whenever they're in America, for example. CBS News stated in an article that undocumented immigrants live in fear of deportation and having to leave their families behind. So if you're an undocumented immigrant and you have children in the States, they're allowed to stay, but if you get into a car accident or don't have insurance or get caught by the police, you might not be able to see your kids ever again if you get deported. CNN discussed that undocumented immigrants also have a risk of battery and rape, and they can't get help because they're afraid of being deported if they report it. So this just goes to show that women who are undocumented really do face extreme hardships, including like sexual harassment at work. The American Psychological Association shows that immigrants are always worried because of raids in their area as well. So you can really see that they face extreme hardships, but in order to address these issues, it's important for us to know how we can change this. Changing the attitudes towards these individuals can also help satisfy the need for what these people need. So if we begin to get rid of the stigma against undocumented immigrants, we'll be able to kind of just help this population a little bit better. A study discussed in Research and Practice shows the importance of incorporating policies towards accessing health care for this population. So by implementing policies as nurses or as business professionals or whatever, we can help this population as well. Also, by improving the workplace, we can also help the undocumented women so that we can improve their mental health and their well-being. Even just by choosing one of these options, we can make a difference in these women's lives. So also by understanding the way that God sees us can help us understand more about these people and love them in a better way. God doesn't want us to live in fear. He says so in Matthew, and talks about how he doesn't want us to worry. He also sees all of us individuals in the same way. And in Romans 2:11, it talks about how God doesn't show favoritism. So we shouldn't be receiving any more privileges that the undocumented aren't. We are also image bearers of God, and it says so in Genesis 1:26, when God said, "Let us make man in our image after our likeness." So we are all created to be image bearers. So as Christians, we are called to love all individuals the same, and as God has loved us. Being Christians makes us essential change agents, agents of renewal. Undocumented Hispanic women struggle because they have limited access to education, healthcare, and they face extreme hardships in their mental health. Just like the woman from my story, it's essential to give these women a voice. We must treat these women as image bearers. Thank you.